Hi there, this is Dr. John Whitcomb with News Nutrition talking about the waist to hip ratio. They got it right with this one. Turns out we've been using BMI, body mass index, for the last 30-40 years as the indicator of who's healthy or not. And we do know that if your BMI is 22 compared to 25, you have about a 6-fold reduction in diabetes risk. But up to 25 is considered normal. 25 to 30 BMI is considered overweight, and over 30 is considered obese. But there's an awful lot of men who are muscular, who have BMIs of close to 30, and they're not one bit over obese. In fact, so many men who are muscular or work out or physically fit look like they're obese, and that has implications for insurance companies and just general health knowledge. It doesn't work. What works, what goes wrong, where we get in trouble, is as we age, we lose muscle mass and we replace it with fat, and that fat is in our bellies, and we become pear-shaped, or apple-shaped, apple-shaped, and our waist size gets bigger. So it turns out that if you actually look at it and examine it and get the waist to hip ratio, and by that I mean at your belly button, measure your waist with completely relaxed, be honest, in the privacy of your own bathroom, measure at your belly button, what's the size of your waist and what's the size of your butt at its biggest place. And then take that ratio. It's a simple arithmetic formula. Men should be under 0.9. Women should be under 0.85. Interesting. Suddenly that takes into account all the data we've had about metabolic syndrome and waists of greater than 38 or 40 or 42. Different sources have said different things. But certainly we've understood that metabolic syndrome, which is the beginning of diabetes and high blood pressure and inflammation that drives heart disease and it causes, of which 50% of us have it, that's what's driving it. But you can reduce it to a more accurate formula. And the waist to hip ratio identifies somewhere in the range of 10 to 15% more people as being in trouble than the BMI. That's the real problem, our big tummies. If you're putting weight around your tummy, you need to do something about it. I can help you with that. There's lots of strategies that work. I currently do a 5-day fast mimicking diet every month, 800 calories for 5 days. I have gotten used to it. I go through it just fine.